My name is Haleluya Moshi. I'm a physiotherapist from Tanzania in East Africa. Professionally, I'm a physiotherapist, but 50% lecturer in the university and 50% clinical work. And that means working with persons with spinal cord injury. Yeah, I have always valued ISCoS conference because that's where I meet scientists, I meet people who are doing more like what I'm doing, so that I can learn from them, but also have things that I want to share, especially from rural Africa perspective that the world doesn't know or has to know. So to me, it's more of being able to network, to interact, to learn, and also to get people that I can work with at international level, like grants writing and also mobilizing support for persons with spinal cord injury, especially in low-income areas. One of the biggest barriers that we face is an inaccessible environment, because I come from Kilimanjaro region where most of the area is mountainous, but also the roads are not tarmac, they're all rough roads. So most of our clients, when they are discharged home, it's very difficult for them to go anywhere outside their homes. But also most of the public buildings that are there, could be a church or a school or a market, it's not wheelchair accessible. So accessibility is the biggest problem that we have. Of course, we have issues of resources that people cannot afford even a wheelchair, or they cannot afford catheters, or they cannot afford anything that to care for themselves. So it's difficult for them to really compete or in the environment where they live, because they don't have much to support themselves. The only good thing, or the very strong point, is that people are very supportive. Yeah? So the family, the children in the street, so many people are supportive, but that material or that technology that is needed for someone with spinal cord injury is what is missing. Yes, I had a patient who died not many years ago, but he was a man with a cervical spinal cord injury complete at C5, and he survived with the injury in the village in the most difficult environment ever for 32 years. So when I was doing my PhD, I went to interview him to find out what exactly made him survive. And one of the most important things that I found from him and others who survived for many years in those areas is that you need to have a very supportive family. That's one thing. But also to be able to accept the situation, to say, well, I will not walk again, and then pick up the pieces and start working from there. But they also told me that most of their friends who did not make it, they could not accept, and they also used a lot of their little resource they have to seek for alternative way of being able to walk. While these ones who made it possible, they used the little resource they had to invest into, like keeping chicken and so on, and small projects around the house, and they could excel in that one. Yeah, for me as a scientist, I find it very difficult really to build my arguments because of data. There is missing data, and the hospital systems, which are the ones that caring for persons with spinal cord injury, are not built up to pick up specific data for persons with spinal cord injury. And so even when it comes to epidemiology, to say how many and what are the issues, it's not easy to argument on that because we don't have data. So what I'm working on now is a database in my hospital, trying to incorporate the ISCoS dataset in the hospital system, so that we can capture some functional assessments and some elements related to spinal cord injury specifically. And I think with that one, we can have more reliable data. Honestly, it's when I see the outcome of my patients. People who had given up completely on life, but when we move with them with therapy and counseling and psychological support, sometimes we have to bring in peer supporters to talk to them. And when I find them 1 year later in the college, 1 year later maybe at work, 1 year later maybe leading something very good in the community, that makes me more passionate to keep on working, honestly. Yeah.